Welcome to this video about the Care Act duties on carers assessments. Please note we have other videos about this topic on the Sky website, alongside other resources and a handout with key messages and reflective questions. My name is Jackie and with me today is Kevin Minya. Today we're going to be talking about carers assessments and particularly focusing on who carers assessments are for. Under the Care Act, there is a duty to provide carers assessments to carers who are defined as an individual who is providing unpaid and necessary support to another individual. I think that we sometimes have difficulties understanding about whether we see ourselves as a carer or perhaps just giving support to a loved one. And I'm going to ask Kevin how he feels that we, as social care practitioners, how can we encourage people to come forward and ask for a carer's assessment if they don't necessarily see themselves as a carer?
Hi, Jackie. Yeah, I'm going to say sort of thing that just came to me as you were introducing it there is that it's possibly that the easiest way to decide on this is who is not a carer. Yeah, and I used to, promote our local carer charity at flu vaccinations, and I used to go there and do. And the problem, I used to get lots of people that would reject my approaching them in lots of ways. And one day I made the unfortunate mistake of talking to somebody from a different heritage, a different background, and they came away thinking that as a parent they were a carer and the Care Act was available to them, and of all the roles I've seen, that's probably the only one that isn't covered by the Care Act for a carer's assessment. That's somebody who has a child who doesn't have additional needs. And so the real question there is when does a carer actually have extra support needs, rather than whether they are a carer or not. And from what I can see, that is really when you end up supporting somebody in ways, we talk about it, for their daily living. Yeah, their activities of daily living, as people need extra support in that. And I think that is one way of actually encouraging people to come forward, is to say that, do you help that person to get up in the morning, to get dressed in the morning, to find something to eat, to deal with their bills, their finances, their whatever. It can be any of those things as to what it is that is a part of a caring role, which is over and above a traditional expectation of an adult to be able to look after. So the question then is it significant enough in order that you do need extra support, and is it perhaps going to be for a duration, a length of time which is going to impact the quality of your life ongoing? So I think really we should actually just check to see whether anybody, and the reason I'm saying this is because it's prevention is that we want. If you don't get the support you need early, then there will be carer breakdown. There will be a place where people can no longer do it. Many diseases are progressive, and that may well be the outcome. But anything we can do to delay that is good for that person's quality of life, their relationship, all economic aspects of that as well. They'll be able to stay in employment for longer, having a career, have a life outside your caring role. And one of the sort of we were talking on another video about how volunteering and things like this is good because it gives you company, it gets you company. And quite often, I've heard stories of people who say that their neighbours will no longer talk to them anymore because they know that one of a couple is no longer able to converse in the way they used to, and they lose friends basically. So it is really about can we help now?
Absolutely. It's really interesting you saying that, because actually becoming a carer, it can be really isolating, can't it? Because you can't do the activities you did previously. You might not be able to work. Friends and neighbours may feel that you're too busy to actually have contact with them. So it can be really, really isolating. So that was a really good point. And I think you're absolutely right, because I think under the Care Act, we consider somebody as a carer who just helps somebody, an individual in their day-to-day life who would struggle to cope without your support. And there's such a range of areas of support that a carer might give. So I think typically we might think of perhaps helping someone with their personal care to get them washed or dressed, or use the toilet, or to be able to eat and drink if they're not able to do that by themselves. But there are actually a huge number of ways, aren't there, how people can care, maybe not even if they live in the same household or in the same area. And I think you mentioned about helping with budgeting and things like that. I think it's really useful, isn't it, for us to be aware that people can be carers doing a range of different ways of support.
Yeah, absolutely. And it's amazing how important some of the relatively, well, I wouldn't call them simple because they're not, but a number of people will not answer their mail. They will not open their mail. And they actually need somebody to come in and actually do that for them and help process that. And there are many people whose benefits get cut because they've not processed their mail. And if you help them with that, it would be really nice if we recognise and acknowledge that there are people that are doing, filling out application forms for benefits in that way as well. Disabled badges. Some of these things, they make life so much easier for the cared for, but also for the carers. Because if you've got to, if you provide the free taxi service, as many carers do, then to actually being able to guarantee that you'll have somewhere to park and you'll be able to take that person to the area makes all the difference, especially if you're squeezing it into a working day. And we still see many retired people being as carers, and I do wonder if our inability, I suppose, to support carers of employment age. There is no limit to employment age, but who would traditionally want to work, be in work, need to work, because one of the downsides of being a carer is that you often don't have a pension. When you retire, you don't have any savings. You don't have a house of your own. You don't have, because you haven't been working, or you haven't been working as much as you might have done. Your career suffered for that reason, and so there are lots of financial things, and there are interesting reports on the poverty crisis and how people who are their last years of life are impacted by poverty. But that still leaves a carer who is impacted in poverty, and you may lose your home. You may lose your home when the person you're caring for is no longer here. So it's a carer. The impacts on carers are huge and ongoing.
Absolutely, and so vital for us to be putting in packages of care and support to carers, and that kind of starts from the carers assessment, doesn't it, to find out what their situation is, how able they are to continue caring in their role, whether they want to continue caring in their role, and how it impacts on other areas of their life. And I think it was really interesting you mentioned that the taxi rides, people taking them to doctor's appointments, hospital appointments, it's still caring, isn't it? Helping people with medication, providing, emotional support is an area I think in caring is something we don't always think about, do we, about providing emotional support as a carer?
That's an excellent point. I go to carer support groups, and we talk about different ways of getting that sort of emotional support for carers as well. We can mindfulness, meditation, spiritual care, the exercise is good. It makes you happy as well to do all these things. These are good for, but equally, one of the ladies there said, I wish I could get my husband, the person that she cares for, on the CBT, but he won't do it. He won't do this cognitive behavioural therapy. He won't participate in that. So you actually do provide a lot of emotional care, and co-carers provide emotional care for each other. I supported my dad in that way, but also a lot of people are codependent. We're seeing more and more people who have got maybe dementia or mental health issues, caring for people with physical health issues in their family, and vice versa, or sandwich carers as well, where you care for a spouse or a parent or a child. So the dynamics are unlimited, really, and the way that these things actually lay out.
Definitely. That's really interesting. And I think another thing that's quite useful for us to think about is that we tend to think of someone caring for a family member, but I think it's also quite important that a carer can care for a neighbour or a friend. It doesn't have to be somebody within the family. And I think that's something quite important for me as a social care practitioner to be mindful of that. If somebody comes to me and says, well, I'm a carer and this is what I'm doing, but they're not a family member. So we need to be kind of quite broad how we interpret who is a carer. And I think there are all sorts of differences that we need to think about. A carer may not even live in the same locality as the person they care for, so sort of caring by distance, and there's sort of the complications that might include.
Absolutely. Again, and the quite often you might have somebody in the family will register as a carer, but nobody else will. Well, no, you're the carer. I'm not the carer. That's another way. So one person has sort of bitten the bullet in a way and decided to do that. Equally, neighbours maybe and others that are nearby or friends, they don't want to register as carers because they might think it means that they are liable for that person's care. So they are committed to caring. They are committed to doing those things. They can't go off and have a holiday or whatever it is because even though they probably won't, because many people are very committed to their neighbours and their friends and doing this role. So I think this is one reason why people don't register, is that they think there's a liability, a requirement, a responsibility that gets added on top of what they're already doing or willing to do. So again, that's why people don't come forward. There is definitely people who say that I'm not their carer, this is my spouse and that, and I don't really get that. I'm afraid to say I don't really get it. I certainly never had that problem. My dad never had that problem in doing that. We recognised that we were doing more than what we do. In fact, it's a health condition as far as I'm concerned. Therefore, we're providing the equivalent of nursing care. I suppose that may be why I thought of it that way. And I do wonder if some of these other concerns are really what's going on, rather than, especially, it isn't unknown nowadays about the plight of carers, and it is a plight. I call them sometimes the largest underserved community in the country, because caring does affect your health, it affects your well-being, and affects your wealth as well. As we've sort of spoken about earlier on. So it is a huge, what do I call it? Not a time bomb. It is a bomb, but it is a time bomb. Yes. Yeah.
Definitely a vast number of people who would benefit from a carer's assessment and get sort of support planning in place for them to help deal with their roles. Absolutely. And I was just sort of thinking about the Care Act and how it introduces whilst it introduces national rules for deciding who is eligible for care and support, it is actually interpreted by local councils to make the decision about whether or not carers' needs meet those rules and whether or not you have eligible needs. So just looking at the definition from the Care Act, it said that the eligibility criteria is met if there is likely to be a significant impact on your well-being as a result of your caring role, and that they have 3 questions that need to be considered when they're making that decision. Those 3 questions are your needs the result of you providing necessary care? Does your caring role have an effect on you? And is there likely to be a significant impact on your well-being? So if the answer to those questions is yes, then you have eligible needs, and then hopefully through a sort of a care and support plan, those conversations in a carer's assessment, which, as we've sort of talked about before, is that sort of structured conversation between the social care practitioner and the carer. We ought to be able to tease out what care and support would be helpful for that carer to maintain their role. I know that you do an awful lot of work in with carers organisations and support carers. Does that feel something that sits comfortably with carers, Kevin? Does that feel like a good approach? And do they have experience of that? Do they have those conversations as part of their carers assessments?
I think they do. I think they tend to be that that the decision's already been made that it's not. If you've got a low level of need, it's very difficult to say that the need you've got is purely because of your caring role, and maybe you had the need before your caring role, but you never got to address it. I would really say that if you're going to do a carer's assessment, you should always leave the person with something that's going to improve their quality of life, their well-being, their ability to cope in that way. And, make it, it should always have an outcome that's positive for that person to do that, which will definitely maybe improve the stats on saying, did that care assessment do any good? Even if you said that you're not eligible, there should still be some advice and information that can be given, which is part of the Care Act anyway, to give information and advice about these things. I think where it gets a bit hung up is what is free and what is not free. And what is going to be paid for or provided. And, whether you like or you don't like the term social prescribing, I think, it is a very good term to actually cover some of these things that we're doing. So if you've come into a household and somebody has shared, you've gained their trust, you've had this conversation, and they've actually shared with you what it is that they're struggling with, then you should have at your disposal some ideas as to what they could do in order to break that cycle, maybe that negative cycle they're doing, whether it is get back with old friends or create new friends or go to a carer support group or whatever it is that would fit into that person's lifestyle, that they would do that. And ideally, not just signpost, not even just suggest, but hopefully maybe follow up and find out whether they've gone there, or arrange for somebody to take them there to do that. Because after the lockdown period we had, we provided a service where people would actually, it was called First Steps, where even carers were too scared to go out, to do things, to go back into activities, sort of thing. Not the person who's got the health condition, but the carers were reluctant to do that. So I think there's some of the other sort of concerns, I suppose, which we haven't touched on here, is that if they're of employment age, then, or if they've got carers allowance, if they've gone that far, they may think that this carers assessment's going to affect that or take it away from them, or they may not think they're entitled to it. Certainly, they go back quite a long way, and I still don't think it's common knowledge that family carers, people who live in the same home, are able to provide direct payments or payments through direct payments or grants or the direct payments for carers, and they don't know whether it will or it won't be means tested, because we know that under the Care Act officially it can be, but many local authorities have waived that for carers, recognising that it is a time bomb to some degree, and that it does need to be addressed, to prevent that. So there are lots of reasons why people don't. We also, we are having, men are not coming forward as much to get support, to get well-being and that, and also in our area, it's that people of other sort of minority ethnicities are not coming forward as well. So there is definitely some things to learn on that, and gain access through maybe community groups or faith groups to actually gain access to people that, again, part of the Care Act. It's not a matter of waiting for them to come to you. We are supposed to search them out. Yeah. So
yeah. Absolutely, yeah, and actually under the definition of the Care Act, it is about when they become aware of a need. So that is something that we need to do, I think, in a greater way, to try and find and encourage people to come forward. And I really like the way you described there some of the really important key issues around a good quality assessment. It has to be person-centred. It has to be led by the carer, doesn't it? So that you have those conversations around what your needs are and what will be helpful for you to continue in your role. And indeed, even if you are willing and able to continue in your role, And also, I think you also mentioned about how people's needs might fluctuate and change. Their circumstances may fluctuate and change. And so therefore, it's really important for us to, kind of revisit and review carers' assessments and make sure they're still relevant and, what people need and be proportionate, I think, as well, to their needs and flexible and adaptable as things change. So they were really great examples, actually. Thank you, Kevin, for sharing those with us. So I think it's, for me as a social care practitioner, it's around doing a strengths-based approach towards carers' assessments and really being applying the 9 areas of wellbeing to every part of those conversations that I have with carers, in bringing out the best of their needs and their views into what makes a really good support plan, which I guess is what we want at the end, isn't it? Some form of support, like you mentioned. If it's just information advice, that's what we need, and we're only going to get to that through a conversation. I think that's been brilliant. Thank you so much, Kevin. I would just like to thank everybody for listening, and also please do check our website. We will have further videos and resources on this and other themes on the Sky website. Thank you.
Thank you.